1. Subclinical hypothyroidism in pregnancy. A 29-year-old woman planning pregnancy has TSH 8.9 μ/L, normal FT4, and positive anti-TPO antibodies. She has no symptoms. Which is the most appropriate management? A. Start levothyroxine. B. Observe and repeat labs in 6 months. C. Start propylthiouracil. D. Radioactive iodine ablation. Answer. A. Explanation. Subclinical hypothyroidism with TSH greater than 4 to 5 μ/L, especially with positive anti-TPO in pregnancy plans, warrants levothyroxine. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 2. Severe hypothyroidism, myxedema coma. A 72-year-old man presents with hypothermia, bradycardia, hypotension, and altered mental status. Labs. TSH markedly elevated, FT4 low. Which initial treatment is correct? A. Oral levothyroxine 50 mcg. B. IV levothyroxine plus hydrocortisone. C. Radioactive iodine therapy. D. Methimazole. Answer. B. Explanation. Myxedema coma is life-threatening. Treat with IV levothyroxine and empiric hydrocortisone until adrenal insufficiency is ruled out. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 3. Methimazole safety. A 42-year-old woman with Graves' disease has been on methimazole for 3 weeks. She now presents with fever and sore throat. Which is the most appropriate next step? A. Continue methimazole, add antibiotics. B. Discontinue methimazole and order CBC. C. Switch to levothyroxine. D. Administer radioactive iodine immediately. Answer. B. Explanation. Fever and sore throat may signal a granulocytosis, a rare but serious methimazole effect. Stop the drug and check neutrophil count. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 4. Radioactive iodine contraindication. Which patient is not a candidate for radioactive iodine ablation? A. 28-year-old woman with toxic multinodular goiter. B. 32-year-old man with Graves' disease and exophthalmos. C. 60-year-old man with recurrent hyperthyroidism post-surgery. D. 25-year-old woman, 12 weeks pregnant, with thyrotoxicosis. Answer. D. Explanation. Radioactive iodine is contraindicated in pregnancy and lactation. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 5. Beta blocker selection. A 55-year-old man with new Graves' hyperthyroidism has resting HR 120 bpm in COPD. Which is the safest initial agent for adrenergic symptom control? A. Propranolol. B. Nadolol. C. Atenolol. D. Amiodarone. Answer. C. Explanation. Non-selective beta blockers, propranolol, nadolol, worsen COPD. Cardioselective beta blockers, atenolol, metoprolol, are preferred. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 6. Thyroid nodule with risk factors. A 63-year-old man with a 4.5 cm thyroid nodule has a history of childhood neck irradiation and hoarseness. Ultrasound shows a solid hypoechoic nodule. What is the next best step? A. Observation. B. Fine needle aspiration biopsy, FNAB. C. Levothyroxine suppression therapy. D. Radioactive iodine scan. Answer. B. Explanation. Age greater than 60, radiation history, size greater than 4 cm, and vocal cord paralysis are high-risk features. Right-pointing arrow. FNAB is required. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 7. Postpartum thyroiditis. A 32-year-old woman, 3 months postpartum, presents with weight loss, anxiety, and tachycardia. TSH is suppressed, FT4 elevated. RAIU is very low. What is the most likely diagnosis? A. Graves' disease. B. Toxic multinodular goiter. C. Subacute thyroiditis. D. Postpartum thyroiditis. Answer. D. Explanation. Low RAIU with hyperthyroidism in the postpartum period is typical of postpartum thyroiditis. Compendium of Therapeutic Choic. Compendium of Therapeutic Choic. 8. Levothyroxine dosing in elderly. A 75-year-old woman with newly diagnosed hypothyroidism, TSH 15, low FT4, and CAD requires levothyroxine. Which starting dose is most appropriate? A. 25